Everybody, I thank the organizers for welcoming me to this beautiful city of Ahmedabad. And as always, it's a pleasure to be here with you. In the next few minutes, we will go through dialectical behavioral therapy, and I'm going to focus on micro skills for primary care providers and settings. I would like straight away to acknowledge Society for Adolescent Health and Medicine. We did a workshop twice in a year for providers, and it was a grand success. So some of the slides are from that workshop. Also, Dr. Vinay Korpade, Associate Professor, Child and Adolescent Psychiatry, KLE, Belgaum. We often start a DBT session with a mindful moment. Let's do that. Get in a comfortable position. Everybody relax. Name 5 things that you can see. I give you a moment to see 5 things. I'm doing the same. 4 things that you can feel. 2 things that you can smell. And 1 thing that you can taste. And now that I have your full attention here, in the next few minutes, we'll understand the basic principles of DBT, imbibe a few skills, and discuss their clinical application. Now, DBT was developed in 1980 by Marsha, and it was adopted for adolescents by Rathers and Miller in 1990s. It is a therapeutic modality originally for borderline personality disorder, but has shown to be very helpful for depression, bipolar disorder, eating disorder, PTSD, and substance use. For teens especially, it is extremely important to deal with impulsivity, suicidal behavior, managing emotions, staying in the moment, and maintaining healthy relationships. These are very simple skills with high impact, and they have been proved by research over and over again that the counseling for suicidal behavior is best dealt with DBT. So we have been talking about the immediate safety plan for suicidal behavior in Adolescent Health Academy and IAP. Now we are going to the next step. How do we counsel them in clinical practice if they refuse to go to the psychiatrist? And if the psychiatrist says they are doing DBT, we should know exactly what it is. So DBT is based on the biopsychosocial theory, which we are all familiar with. You know, adolescents are emotionally sensitive, they are reactive, they are slow to return to the baseline. And if they have an invalidating environment, like they have teachers who do not understand them, they have parents who totally kind of scold them again and again for minor mistakes, put them down, hurt their self-esteem, they have a society who does not understand their emerging needs, there's going to be pervasive emotional dysregulation. Yes, maybe all adolescents require some element of DBT. The core assumptions are people are doing the best that they can. People cannot fail in DBT, and that's pretty positive. People may not have caused all of their problems, but they have to solve them anyway. So there is a dialect in DBT. I love my mother a lot, and I don't like her when she scolds me. So love and don't like. So there is a dialect, and we validate that. Yes, when your mother scolds you, you don't like her. So there's that validation there. Or I'm terrified of change, and I'm terrified of staying this way forever. So this often happens in life, and this causes conflict and intense emotional dysregulation. So you can be introvert and still you can be reaching out. You can be capable and still you can be lost. So these are the dialects which we try to make the adolescent understand and how to deal with it. So how does DBT work? DBT works by accepting such emotions, validating such emotions, and then using mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness without harming. So it is healthy coping of emotions. It can be done in an individual setting, in groups, in schools even, telephone coaching, and also the therapist often has team meetings. So it is a multimodal therapy. What is the basis? We all know calm is wisdom, wisdom is calm. And adolescents are on an emotional high. What are we trying to do? We are trying to help them to develop a wise mind, which has clarity, intuition, balance, authenticity, and compassion. We are all familiar that adolescence is a window of opportunity. Yes, they seek enjoyment, they seek emotional drive. They are often not very logical, they are not very thoughtful, but adolescence is a wonderful window of opportunity because brain is under construction, and if they can inculcate DBT skills at a younger age group, they will do that for a lifetime. Pause and respond. That is the basis of DBT. Why? When we name emotions, we settle our amygdala. The stress response reduces. Insula, when we understand how we are feeling, we understand the body-mind connect, we develop emotional insight. And then the prefrontal cortex kicks in. You know, in adolescence, it's so difficult for the prefrontal cortex to kick in because it is neurodevelopmentally immature. But we know that, the wiring of the brain takes place in the adolescent period. And can we wire them to use more of their prefrontal cortex? So the components I've already told you, in adolescent age group, the extra component is walking the middle path. And this is a parenting component in which we parent with the partners to teach them conflict resolution skills, negotiation skills, so that they can help the adolescent. So how do we go about this? We explain to them the goals and rules of treatment. We analyze the problem behaviors. We maintain a record of mood rating, newer skills, how to manage stressors, and how they can manage distressing emotions without cutting themselves, without taking substance use, without binging on the media, without binging on food. And this is how we go about it. So let me start off with this case. So this was a 15-year-old girl, and she, during exams, she used to miss her dinner and sometimes get up in the night to have a nighttime snack. So the mother hears her when she gets up, and the mother comes to the kitchen and she says, "Oh no, so now you're eating again and there'll be dirty dishes to wash." What does she think? Oh no, my mom doesn't understand me. There is shame and anger. She gets angry, she throws the cup and the cup breaks. And mother shouts again, obviously, "What is this? You have created more mess for me." She gets extremely angry. Nobody loves me. And she goes and cuts herself. So what do? There are lots of problems here. But in DBT, we focus on what is most important, what can be the most life-saving. And this is what will be our first point of focus. How do we do it? So ABC, please. You'll have a lot of mnemonics in DBT. So let me go through a few of them. So ABC is the baseline. Always accumulate positive emotions in life. Be positive. Build mastery. Build mastery over your hobbies, over your skills. So eventually you build mastery over emotions. Be ready ahead of time. Role play. How to deal with emotional situations. If you're having a physical illness or mental illness for that matter, please take care of your medication. Balanced eating. Avoid mood-altering substances. Balanced sleep. Get exercise. Healthy lifestyle, bottom line first. Think of a surfer going over waves, right? And these waves are waves of emotion. John Kabat-Zinn, he is the father of mindfulness, said, "You can't stop the waves. You can't stop the waves of emotion, but you can learn how to surf safely." That is what we need to tell the adolescent. So when you have an emotional high, don't react. Push the pause button. Very difficult for adolescents to do. Label your emotions, observe, go through a healthy distraction technique, and when you come down, reflect, be compassionate, and then think what to do. For what do we need for this? We need mindfulness. We have to be mindful of what's happening with us, what's happening with the other people, how are we feeling? And if we have our phones on, we cannot be mindful. So paying attention on purpose in the present moment and non-judgmentally. I don't like my father. at this particular moment, I don't like my mother. Yes, I accept this emotion. I'm mindful for it and I totally accept it. I feel like cutting myself. Now I have to save myself. How can I save myself? And this is the crisis survival skill. If we run away from our emotions, they cause more trouble. So we accept them and then think what to do. Just like we soothe a baby, right? We soothe ourselves. We soothe our six senses. And we need to develop this kid ourselves. So this is an invite to the adolescent. These are some of the techniques that you can use. You may like them, you may not like them. Choose whatever you like. Develop your own self-soothing kit. You may have the picture of your parents who soothe you. You may like the smell of a perfume. You may like to taste a chocolate once in a while. You may like to touch your teddy bear. You may like to listen to soothing music. Or you may like to dance the dandiya or maybe yoga. So you develop your own self-soothing kit to calm yourself. So that is the first point. Then you also teach them TIP. So what does TIP stand for? Temperature, intense exercise, paced breathing, progressive muscle relaxation. So those of them who are not the very self-soothing types, you tell them, simple. Splash your face with cold water. Place a bag of ice or cold pack on forehead. Use a cold facial roller. Take a cool shower. Calm down. Pause and then think. Those of them who don't like the water, maybe intense exercise, dandiya at a great speed so that your heartbeat goes 180 per minute and you use up all your stress hormones. Invitation, it is not a force, remember. Paced breathing, belly breathing, abdominal breathing, box breathing. And if we have some time, I will do this with you together. These are excellent techniques to teach the adolescent because when we do deep breathing, we check into our parasympathetic nervous system, which is very, very calming. So that is the idea here. Similarly, progressive muscle relaxation. When we are under stress, when we are angry, all our muscles are under contraction. We are we want to just pounce on the other person. Relax, cool. Relax your muscles. This is what we tell them. Maybe we will do it if we have time in the end. So what are we doing here? What have we done? Using the self-soothing technique and the TIP techniques, we have told the adolescent, pause it, and then respond. And how do you respond? You think, my mother's behavior, is it under my control? Not at all. My behavior, is it under my control? Of course it is. My behavior is the trigger to my mother's behavior. Can I do something to improve my behavior? Can I read in time so that I don't have to miss my dinner and do that last minute studying? Can I learn how to speak to my mother? So these are so many problems and we use the problem solving technique to solve these problems. So this young girl decided to talk to her mother, and this is interpersonal effectiveness skill or communication. It goes by the acronym Dear Man. Describe, express, assert, reinforce, mindful, appear confident, negotiate. Amma, there are times that when I'm not able to study, I do get up in the night for a snack. I promise to clean up the dishes, and if I disturb you, I'm sorry for this. I'll try my best, but if by chance you come, I wish you ask me, why did I get up? I promise I shall do better next time. That's it. That's all that parents need. That's all that you need to cool down. So let me just test this out. I'll just take last two cases with all of you. A 16-year-old, a great Carnatic music singer, after post-COVID, she got a little, anxious because she's spending a lot of time in her house. And when people used to come to talk to her, she used to choke, right? She just couldn't speak. What do you think? What will work for her? Let me give you a clue. Tip. Any of the tip you feel? She's a singer, remember? Breathing. Yes? So breathing good for singing and good for calming your time. So you see somebody coming in, moment you see somebody approaching, get into the boxed breathing or belly breathing, say calm, say chill. Try it out and see how it works. These are real cases. It worked really well for this young girl. The last case, learning disability, father a mathematician. Whenever there was a mathematics exam, there used to be a panic attack, right? And not willing to go for remedial education. So again, what would you do in a panic attack? Which skill? Anybody? Relaxation, excellent. But remember, I started my presentation with 5, 4, 3, 2, 1. Ground, ground. In a panic attack, ground. After that, do progressive muscle relaxation on a daily basis to build up your parasympathetic tone. Of course, plan your studies well. Of course, improve your interpersonal communication with your parents. So all the skills come into the picture. We released this book yesterday. Very, very honored to have edited this book with my teacher, Dr. M.K.C. Nair. And this book contains a whole chapter on DPT by Dr. Vinay Korpode. And I urge all of you to read this. I also take this opportunity to welcome you to the World Congress on Adolescent Health in Jamaica and to celebrate International Adolescent Health Week from 13th to 19th October, focusing on DBT, focusing on mental health, on physical health, on spiritual health. Take this opportunity. Remember the breathing, the pranayama, it all comes from our philosophy, from the yoga philosophy. So the key points are dialects will always exist in our life. How we cope up with those dialects in a healthy way is extremely important. DBT is in fact a form of CBT with inclusion of mindfulness and acceptance. It is a multimodal therapy and the components, just to reiterate, are mindfulness, distress tolerance, emotional regulation, interpersonal effectiveness, take the parents on board, walking the middle path. Viktor Frankl, I'm sure many of you have, and this is one of my favorite quotes, and this is what DBT is all about. Between stimulus and response, there's a space. In that space is our power to choose our response. Whether we self-cut, whether we calm down, whether we go and give a hug to our mother and say all is well. And in our response lies our growth and our freedom. We all need to build a life worth living. Not only we should live a life worth living, we should make sure that adolescents under our care build a life worth living. And this is the title of the memoir by Marsha M. Linehan, the one who actually got DBT to all of us. She was suffering from bipolar personality. She was indulging in self-harm. She has scars on her forearm, and her patients tell to her, "You are one of us." Thank you very much for a very patient hearing.
Thank you very much, Preeti ma'am, for as always your specific and interesting and very impressive session. You took us through the ride of difficult CBT in such an impressive and interesting way. We were feeling like we ourselves are actually living those scenes and everything. Thank you very much, Preeti ma'am, as always.
I have extra 2 minutes. Can I just do a quick DBT exercise, if it's okay with all of you?
Yes.
Yes? Yes?
Yes, ma'am.
Okay, so very quickly, I'm going to tell you the easiest breathing exercise, which I didn't mention here, right? And this is the physiological sigh. So when we get tired, we all sigh, yes? So if you have to tell your adolescents to quickly get their parasympathetic nervous system into action, what do you tell them? And I urge all of you to do it with me. I'll just explain what it is. Take a deep breath in. And when you take a deep breath in, feel your abdomen bulging out, right? After you've taken a deep breath in, take another short breath in. So 2 inspiration, 1 long inspiration, 1 short inspiration, and then a long expiration. Can we all do it together? Take a deep breath in. Feel your abdomen bulging out. You can keep 1 hand on your abdomen, 1 hand on your chest. Feel your abdomen bulging out. Take another smaller breath in. And then exhale out. And feel your abdomen sinking in. Okay? If you do this 3 to 5 times, your parasympathetic nervous system checks in. Again, invite the adolescent, don't force. My last mindful exercise, close your eyes. All of you, close your eyes, sit back. There's nothing to do. There's nowhere to go. Breathing in, I know that I'm breathing in. Breathing out, I know that I'm breathing out. Feel the cool air touching your nostrils as you breathe in. And feel the warm air coming out of your nostrils as you breathe in. Thoughts may come. Think them of passing clouds. Do not stick to any one thought. Breathing in, I know that I'm breathing in. Breathing out, I know that I'm breathing out. And now, slowly open your eyes and thank yourself for being mindful for a few minutes. Thank you very much.